And so I would love it if you could maybe even just spend a few minutes. You came from UTD and are an alum of the graduate programs.
And
So
I am, yes. I'm
yeah,
more than happy to talk about
great.
my experience at UTD and how I got to where I am today.
Perfect.
So I started out at this little small school in McMurray when I first graduated college out in Abilene. Was playing soccer out there, and the soccer team fell apart. And so I was like, you know what, I'm going to move back home and go to UT Dallas. It's a great school. It's where I'm from, and came back here middle of my junior year of undergrad, and played men's soccer my senior year. I'm super thankful and grateful for that opportunity. It was a lot of fun. I actually just did an alumni event a while back with the soccer team, which was great. And then my undergrad was in literature, and I didn't really know exactly what I wanted to do. So I went to law school. I went to law school at SMU for a couple of years, and ended up realizing that the legal profession is not something that I wanted to get into for myself. Just not something that I saw being conducive towards my happy-go-lucky, positive, optimistic personality. And so I went back to school at UT Dallas and completed my master's in healthcare management, which I'm super excited about. I love the program. I was very fortunate to begin the program when Dr. Forney Fleming was still the director and running the program. And Dr. Fleming was fantastic. I mean, I think the program was like 5 years old when I started. I got my degree in 2014. So dating myself a little bit, but I'm not that old. So just loved the program, loved what it encompassed, all the different courses and options that it provided. And I was at the time was working full time. I was doing recruiting full time for a physician recruiting firm, the Medicus firm, and going to school full time, working full time. After I graduated, I had the opportunity to advance in my career on the recruiting side of things with a company named Arthur Marshall here in Dallas, and did great there. I was responsible for recruiting physicians and high-level advanced practice providers in the Texas and Oklahoma markets, and it was great. But then I had a friend that opened up a startup company for the medical diagnostic and preventative services for ancillary services. So I spent a couple of years going around helping primary care providers generate revenue for their practices outside of their traditional sources of revenue, adding things like allergy practices or specific testing for ADD or cardiac tests, things like that they could use that would benefit the patient, but also benefit them financially without putting any financial obligation on the patient. But unfortunately, that company went under, so I was able to get on with a firm that specialized in recruiting physicians and nurse leaders at large academic hospitals throughout the U.S. And so for 2 years, I spent a lot of time recruiting physicians in the oncology, cardiology, and surgical services fields for hospitals like Johns Hopkins up in Maryland, as well as UT Southwestern here in Dallas. I worked with very closely with their director of their cancer center, and placed a bone marrow nurse transplant manager, as well as a regional site director and a couple other things for them in the last few years that really helped build their cancer program, and they're now the number 32 cancer program in the country. Very recently, I was given the opportunity to come on at Pacific Dental Services, which is what I'm going to be talking to you guys about today. I just joined in July, and I love it. I love it. Coming from the agency side and then working on the corporate side of things has been a huge switch for me because it's really more focused on the patient than it is the provider with corporate. And that's what I love about Pacific Dental Services is the focus on the patient. So wanted to kind of go over kind of who we are, what we do, as well as identify, areas of opportunity for you guys that you could look at, in your careers going forward, to identify potential areas that you'd be interested in pursuing. We are looking at developing a externship or internship program with UT Dallas, hopefully sometime in the near future. We're working on that. I know Quincy, you're probably going to work on that a little bit, but looking at getting some operations manager, trainee externships and internships set up. We have, so just to kind of go in, I guess I can go ahead and start sharing slides and go into about Pacific and what we're doing and how I get to be a part of that and how you guys could potentially be a part of that and, what your options are even outside of Pacific. I want to give kind of an overview of the dental industry, how it differs a little bit from the medical industry. It's quite a bit different. So I want to go into that as well. So I'm going to try and start sharing slides. Well, I hope this works.
And if you have any issues, I can maybe do the slides for you but it looks like it's working great.
Perfect. Okay. All right. Does everybody sees that one? Okay, cool. I'm going to ask you to take out your cell phone real quick. Hopefully that's not on a, let me see, make sure this is not on a timer. Doesn't look like this. Anyway, so yeah, if you could take out your cell phone, I've got a QR code on the next page that I'd like you to scan in, and that way we can kind of get an accurate representation of who was actually here today. So if you guys wouldn't mind. There's a couple more seconds. Awesome. So just to kind of give you an overview of Pacific Dental Services, we were founded in 1994 by Stephen Thornton. His dad was a dentist, and he really saw an opportunity for someone to come in and develop a company that provided good dentistry and did it the right way. The dental industry is very fragmented. I'm just going to put it out there. I don't think there's any one company that has more than 5% market share, but there are a few large players in the market that really do help drive the growth and development of the industry, and it's becoming even more and more prominent. We're one of them, thankfully. We love that. So we are actually now in 22 states. We just opened our 850th office last week, which is super exciting. The map's not quite accurate. We're also in Oklahoma and in Alabama, so we've even advanced towards that a little bit more, but we are growing very, very rapidly. I would even say aggressively. We're looking at opening 150 more new offices in the next 12 months, which is crazy. I mean, that's crazy. And when you think about it, we actually don't do practice acquisitions either. It's all brand new de novo practices, new practices. So I do have a little video I wanted you guys to look at to kind of identify what makes Pacific Dental Services unique in this industry.
Sure. Anybody else seeing a video? Oh, I don't think the video is somehow connected.
Did that not share? Were y'all not able to see that?
Did not share, no.
Okay. Darn. Okay. Well.
Is there a link? I'm wondering if you put it in, or is there?
There's a link that I clicked on, and I guess it switched windows. And
then you could unshare and then share to that window.
Okay. Let's see. Stop sharing. Open share key. Okay. Okay, can everybody see this screen?
Perfect.
Video?
Yes.
Not what I was looking for. Give me a second. There we go. Okay. Now can everybody see what makes Pacific Dental Services unique?
Yep, it's perfect.
Okay, all right. Let's try again. Second time's the charm.
Is there any volume on this?
So it sounds like you couldn't hear that either. Is that the case? Okay, well, we're going to move on. We're going to move on to the next thing. I was looking for that video, but to give you an overview of the dental industry, there's actually 201,000 dentists. There are 201,000 dentists in the country. There's actually 189,000 practices. So if you do the math, it looks like there's quite a few solo practices, and that's absolutely the case. If I can move my slide back up, I'm so sorry for the confusion on this. Here we go. So there's 201,000 dentists, 189,000 practices. The industry itself generated 156.4 billion in revenue and is looking at 7.5% growth. Everybody has teeth. Well, almost everybody has teeth, but if you don't have teeth, there's also dentures. There's a few different types of organizations that physicians can work for. Many of them own their own practice, private practice. They set up their shingle, and after graduation, and there they go. Others work for some group practices. A lot of them work for a dental support organization, a DSO, and that's what Pacific Dental Services is. You've probably never heard of that, but a traditional DSO, it's a business support entity that contracts with clinicians to provide administrative and operations support for the non-clinical side of things. And Pacific is a little different in that each office that we own is owned in partnership between an owner dentist and Pacific Dental Services. So, we're not entirely corporate, we're not entirely private practice, we're kind of a hybrid model. We partner with the clinician rather than employing them. And that's why we don't acquire practices also. It's why we only open de novo practices. This allows the owner dentist to enjoy full clinical autonomy. We give them the ability to determine best practices, clinical culture. We truly believe in clinicians leading clinicians. And then we come in on the administrative and operations side of things and help out with all the stuff that they didn't go to school for, right? Billing, HR, payroll, insurance, verification, scheduling, keeping the toilet paper stocked. All the stuff that we did go to school for, except maybe the last one. Okay, we probably didn't go to school in order to keep the toilet paper stocked, but it's part of the process of running a practice and running a medical practice. And so this allows the dentist to focus on what's truly important, which is treating the patient. There are a lot of other DSOs out there that, they're a different model. There's a place for that, and they have a different approach. For us, we fully believe that if we take care of the patient appropriately, effectively, and efficiently, that contributes to giving them the perfect patient experience and hopefully making them a patient for life. It's a process, and it really takes a team effort from everyone in the office to make sure that patient is experiencing what their own experience. Everybody's been to the dentist, and you're kind of anxious, and no one likes going to the dentist. So we want to make that process as painless as possible. What are the benefits of a DSO? So like I just said, it takes better care of the patient. In other models, it's very volume based. And so you don't get the dentist really trying to understand what's going on with the patient, where they are, what their concerns are, both medical and financial. With dentists, it's a lot more hands-on than with physicians, from what I've seen. I spent 10 years recruiting doctors, and everything in my experience tells me that dentists, for whatever reason, are very much more invested in the outcome of each patient. And maybe that's because when the patient smiles at the end, you can tell how good the dentist did. Maybe not. I don't know. Maybe that's just kind of what puts them in there. But there's a lot of benefits of being part of a dental service organization. We have the latest technology. So we're a $2 billion company. We did $2 billion in revenue last year. We're also privately held, which means we get to focus on what's important to us, which is taking care of the patient. And so we take care of everything for the dentist, everything from the technology standpoint to making sure that they're covered on a legal basis. And we also offer a lot of growth and networking and ongoing development. I was just in a meeting this morning with all of our owner dentists for South DFW. We have 44 offices in DFW, and we're growing rapidly. We're looking to open between 4 and 10 more, I think, in the next 12 months. So it's a very exciting time. We are wanting to be the #1 dental provider of choice in every community that we serve. And the only way we can do that is by providing the best care, and we know that. And part of what ties into is technology that we offer. You've probably never heard of CEREC. Probably don't care too much about digital x-rays. I bet you've heard of EPIC. So just to give you an idea, CEREC stands for ceramic reconstruction. And, if you've had a crown, has anybody had to have a crown done in the past? Maybe a couple people. Okay. What CEREC does is that allows us to go in and design and deliver that crown on the same day. So there's no more temporaries. There's no more, having to take messy impressions. You don't have to wait to get your final crown put on. It's all done within the same day. Dr. Parker, who I was talking to this morning, he said he designs and scans and designs crowns within 5 minutes, has them delivered within 45 minutes. So that's a significant technological improvement over having to take the x-ray manually, because we have manual digital x-rays now that we can, or mobile digital x-rays that we can do right there in the chair. We don't need you to go to that special spot. So that's nice. And then it gets milled right there and delivered within an hour, as opposed to having to wait maybe 2 weeks. One thing I'm really excited about is the EPIC. We are the first dental service organization to implement EPIC as our electronic medical record. We're very excited about that. It's been a process transferring over from our legacy system to EPIC. We're rolling that out this week. And what that is going to do is that's going to allow us in the future to integrate and coordinate care with our patients' primary care providers. For us, we are very strong proponents of the mouth-body connection and the link between oral and systemic health. There's been a lot of research lately that shows that taking care of your teeth helps you take care of the rest of your body. Brushing and flossing can help prevent Alzheimer's. I'm not kidding. I can send you the link to the research. It's crazy. It also helps with cardiac effects and your GI tract. It's amazing how much your oral health impacts the rest of your body. And so one cool thing about EPIC is like I said, it's going to allow us to integrate care with our patients' primary care providers. So a couple months ago, actually I guess it was about 4 or 5 months ago, we had a dentist that identified a mass on a patient's jaw. We use CBCT machines so that we can have a full picture of what the inside of that patient's mouth looks like, so that we can do laser guided implants. A CBCT machine also allows us to see when there's something that's not quite right. And it turned out it was a malignant tumor on that lady's jaw. And because of what our dentist notified, she was able to get taken care of and done, pretty quickly without any major complications. And in the future, if we notice something like that, we can identify it, tag it, put it on our patient's primary care provider's docket and say, hey, you need to reach out and schedule an appointment with this patient. So, we're pretty excited about that. what are things that we offer that's, differentiates us from everyone else, or at least, gives you an idea of what is provided to you. Everything from, a fun and fast-paced environment, career development and growth. We're very big on giving back to the community. We also provide for continuing education, tuition reimbursement for all of our employees. Competitive pay. I'm very excited about that one. I'm making a very good living here for, what I do compared to what I did in the past. Pacific Dental truly believes in paying employees for the value that they bring to the company, and being as competitive in the market as we need to be to make sure that we retain the highest quality talent. So we got great benefits, flexibility on schedule. I work from home. It's amazing. I love it. I get to work from home. Can't tell you how awesome that is. And there's a lot of other positions and roles that also get to work from home that are on the operations or healthcare management track. And then volunteer opportunities. So like I said, we're real big on giving back. And I'm going to get into that right about now. So with, we on the local level, we do collection drives. We have a mobile dental clinic that we bring out to communities to provide dental services to communities that are underserved, that don't have, access to care. Another thing that we do is we have a serve day, a We Serve Day every year. This year was August 25th. And on that day, every single office in Pacific Dental Services opens its doors and gives free dental care to underserved, uninsured, and patients that just can't afford dental care. We believe very strongly in making sure that each patient is treated as appropriately and effectively as possible. And, we never want a patient to be turned away and not get treatment because they couldn't afford it. So we have financial plans and options in place for, to help people that can't quite afford it. Another thing is we do this thing called Kaboom, playground bells. We'll go out and we'll build a playground in a vacant lot in 24 hours in rural communities or communities that don't really have access to that type of service. We do that. And then right now we have our Smile for Special Needs campaign going on. We are the #1 provider of dental care to special needs patients in the country. And it's not something that many people think about, but people with special needs, if they are not able to be treated by a general practice dentist or someone that specializes in special needs, they have to go to the ER for their dental treatment. And that's so traumatizing for these patients that have, sensory issues and anxiety and things that are just not really able to be controlled unless you are trained to respond appropriately in that situation. And so right now we have a Smile for Special Needs campaign going on. So for every $30 that one of our patients donates, we will take $100 off their treatment. That's a pretty good deal if you ask me. But we're very big on our special needs. And then also we put together 5-week mission trips each year. COVID slowed us down a bit, so we didn't get to do it the last couple of years, but each year we go to Ethiopia, Fiji, and Guatemala on 5-week dental mission trips to provide dental services to communities that don't have access to any dental care at all. So we're excited to hopefully get that back up and running in the next few months. Does anybody have any questions at this point? Can't see. Quincy, anybody? No, we good?
And I don't see anything in the chat either. So I think we're good for now. Thank you.
We're about to get into the fun stuff, all the stuff that you want to learn about, like what options are available to you, what jobs can I work on, how much do they make? We're getting there. So this is the type of individuals that we look for, the right places where they need to go. But it's also, my job is also to develop quality relationships with clinical professionals, dentists and dental hygienists to make sure that we're adequately staffing wherever we need to go in the Metroplex. So it's exciting. It keeps me busy. It's a lot different than what I was doing before. Before I was, if you've ever seen Wolf of Wall Street, that was me. And now it's much more, I get to, help people. I truly do get to help people, and I love it. It's great. So these are some different examples. We kind of went over them. The ROC analyst is the Revenue Operations Center analyst, and then going up would be the manager of the ROC Center. and then all the way up to the CFO. For operations manager trainees, where you start off, there's a very clear progression track toward career track towards regional partner. Our CEO has been there for like 20 years. I don't know if you're going to be able to get there with our company, but he's got to retire someday, right? So, and then corporate, we have trainers for front office, for back office, for field development that really focus on 3 different areas. Front office is focused on receptionists, treatment coordinators, and operations managers to make sure that we are adequately and efficiently presenting everything to patients the way that it should be. Back office is going to be dental assistants and dental hygienists to make sure that they're compliant with OSHA and HIPAA regulations and all that fun stuff. University relations, very similar to recruiting, is split up into specialists and coordinators, recruiters and coordinators. There's also some other options. If none of those appeal to you, we do have options in our legal department. We need people that can help our lawyers put together things, contracts and everything like that. Marketing is a big one. We're actually looking for a regional marketing specialist right now that's going to be responsible for driving our brand and driving our performance through the industry. So there are just tons of different options that you can take, different pathways you can take, even just within our company. And I'm sure there's a lot more, in the dental industry as a whole as well. So I wanted to go over our dental, our operations manager trainee program. This is what we use to really train our operations managers to learn the skills, company knowledge to independently run a Pacific Dental Services office. We have a 4-month program that trains them on every different position, from receptionist to treatment coordinator. Treatment coordinators are responsible for verifying insurance and getting a financial commitment from the patient, as well as the dental assistants, dental hygienists, and dentists. We want our operations managers to be subject matter experts on every aspect of the business. And so for the first 4 months, we actually have them traveling between 3 or 4 different offices to learn from our best people at each position. And then at the end of that 4 months, they go back to their home office, and by then they know everything they need to know and are able to be that subject matter expert and that leader in that office. It's operations managers are extremely important to driving the perfect patient experience and ensuring that each office is financially viable. That was the character. So the responsibilities continued. You got to be able to perform each essential function at a high degree of proficiency. And you're not always going to have somebody there to hold your hand. Operations managers, trainees, you'll have the operations manager of the office there, but we expect them to kind of jump in and really take charge of their development and their growth. A lot of the training program is self-directed, so there's a possibility that you could transition to full operations manager within 2.5 to 3 months, depending. The fastest I've seen is 10 weeks, and they are killing it now. And so it's really a fantastic way to learn how to run a dental office and dental practice from the ground up. And these are just some more responsibilities. One thing that's really big is ensuring the financial viability of each office, and that includes making sure that you're reviewing P&L, profit and loss statements, that you're properly managing the budget. You got to look at expenditures and look at revenue and where there are areas for growth, opportunities for growth, and opportunities to really make a difference on the bottom line. And so it's a very important role. And so here's kind of a career progression example. It's not necessarily linear. So start off as an operations manager, you can go to operations manager 2, and then you would go up to regional manager. So the regional manager is oversees the operations manager. The operations manager would oversee 1, maybe two offices. The regional manager oversees between 5 and 10 different offices. The next step up from that would be regional partner, who oversees in DFW. Our regional partners oversee about 22 to 25 offices each, and then they're the top dog in our region. There's no one above them in each region, and so they report directly to corporate, to the executives. Other career tracks from an operations manager, we have operations managers that become regional front office trainers. My buddy Rich that I was with this morning, that's what he started out as. He actually started out as a dental assistant, went to operations manager, now he's the regional front office trainer. Same thing for national field development specialist and regional recruiter. We have a lot of regional recruiters, not including myself, that started out as operations managers. And for me, I think this is a very effective career move, because being an operations manager gives you an idea of what it's like, boots on the ground, what it looks like in the office and how all the different positions interact and work together. And as a regional recruiter, you get to put all those puzzle pieces together. And so for me, I got to figure out what the puzzle is, what it looks like to begin with, and then I put it together as an operations manager. You already know what that end result looks like. So it's a very smooth segue into the regional recruiter role. You could also go into university relations, or like I mentioned, the revenue operations center as well. Before I get into the classroom focused ideas, one thing that I want to stress is, what differentiates us and what you should really focus on when you're looking for a job is look at the company's mission, vision, and their values, and then see if you could find out whether those match up with the way that they do business. I know for us, our values truly define, who we are as a company, why we do what we do, and why we're so successful. I can send everybody a link to our we believe statements, but it's, things like we believe in the power of teamwork, therefore we succeed or fail together. We believe that we have an obligation and opportunity to present the best dentistry possible to each and every patient. One of the most impactful for me is that we believe that the way we do business is as critical as whether or not business is good or bad. For me, when I'm evaluating job opportunities, when I'm evaluating companies, I really want to find out if they walk the talk or if they're just big talkers. And that's what I love about Pacific is as soon as I came on, the culture matched everything they said and more. All of our corporate and upper management, they've all been there 5, 10, 15 years. So very good tenure. That's also a really big indicator of whether or not a company is truly genuine about the values that they put forth. And so it's really gratifying to see that the we believes and the values be lived out in action each day in the way that we interact with each other, with the interaction between patients. We know that patients pay our salaries, and so we need to do everything that we can to please them. That doesn't mean that every disgruntled patient gets free dental care, because then we couldn't pay our own salaries. So it's what it means is that we do everything that we can to ensure that each patient's experience is memorable for all the right reasons. We want to make sure that they feel valued, that they feel special, that they're educated on all their different treatment options, and that at the end of the day, they do have that perfect patient experience. So I did have some ideas on classroom focused ideas that you guys could take. So anything financial that would truly augment your financial side of things would be fantastic. That's something that we focus on. And another one is operations management, people management. Have you managed people? Probably not. There's a lot of you that haven't had a job, and that's okay. There's classes that can give you an idea of what that looks like. And we're more than happy to evaluate people that don't have direct experience. We are looking to develop an operations manager trainee program throughout DFW that really utilizes highly qualified candidates that are not just experienced, but also candidates that have the education piece. That's why we're really excited to be part of UTD's Healthcare Management Week. Is we're hoping to develop that a little more. Anything with business management would be ideal. because that's essentially what our operations managers are responsible for, is running that individual office's business and driving the profitability of that office, and being able to pull it all together. You got to manage a dentist. Maybe that owner dentist is a little bit has a unique personality. You got to figure out how to communicate with them, really how to get them to see what the big picture is. So it's very exciting. Anything with human resources as well. There's being part of such a big company, there's a lot of moving parts, and it's always good to have a background in human resources when you're dealing with people. And also law. I've also found that, my legal background has helped me in a lot of situations, not from necessarily a knowledge standpoint, but from a perspective standpoint, and how to think about different ideas, how to think about different situations. So I did not time myself, so I hope that's okay. But what questions do we have that I might be able to answer?
Well, first off, I'm fascinated. When we talk about, and when we were first introduced, you were talking a little bit about the endless possibilities, and I don't know about anybody else on the call, but I'm blown away. I think by how much opportunity there is and how you don't even really think about it unless you outline it like you did. So thank you so much.
Yeah. And also,
we do have a question in the chat, but yeah, go ahead.
Any questions? Go ahead. Let's start with those.
Well, the first one was, as a graduate student, are there ways that a student could come and volunteer to get maybe some more idea or job shadow, perhaps?
Absolutely. Get with me after the program. I can put you in touch with one of our regional managers. We're more than happy to have you come into our office and kind of see what an operations manager does on a daily basis. We're happy to facilitate that. So
can I put your email in the chat? Is that okay?
Yeah, please do. Yeah, I'd be more than happy to help facilitate that. We have offices all over the Metroplex. So we have, I think, 2 or 3 in Plano. We have one in Frisco, Prosper, Allen, McKinney, Rowlett, Wiley, Garland, Richardson, Coppell, and Carrollton. So we have a pretty wide range of offices, and I'd be more than happy to help facilitate some shadow days for people.
Great.
I had a quick question.
Yeah.
Can y'all hear me? All right, cool. So I had honestly I thought all dentist offices were private practice or privately owned. So this is really awesome. So I was wondering the whole time, at which point when y'all are planning out a new location, do you get in contact with a dental partner? Do you have a pool waiting, or is it an interview process? How does that work?
That's a great question. So we really do try to do a good job of developing our owners to be ready when those de novo practices open. So we do have a pipeline of dental associate. They're currently associate dentists at various offices that have gone on the pathway to ownership, and we have a formal pathway for them to follow on that. And we tell them, hey, either you're going to get into practice when an owner dentist retires or moves on, or when we open a de novo practice. And so we do have providers already identified well before that practice opens.
Oh, that's cool. All right.
Yeah.
Thank you.
Yeah. And I think we're open. The ones I know of, we're looking at opening one in Rockwall, another one in Wiley, another one in Allen, and then 9 more that my regional partner hasn't let me in on yet.
Well, so Lance, what's kind of the timing of it? So let's say we have a student, and this came up in an earlier session too. Students, and you probably know this too, students can graduate in December, for after fall, spring, right, or summer. But do you all follow a yearly cycle for recruiting, or the manager training program, or what does that look like?
So that's the manager training program is it's not necessarily cyclical. When we have openings, we hire people for it. And so, we're looking to grow. So we will have opportunities going forward, the beginning of 2022. And then especially in the latter half of 2022, when we open between, I think we're looking at opening 6 offices in the first half of the year. Those will all need an additional operations manager. And so we will have someone that covers those offices while those operations managers are in training. But we have opportunities throughout the year for for management.
Great. And so thank you for putting a slide in there about the classes, because that really is what gets brought up with, I'm meeting with a student, or we have other, recruiters come in to say, okay, if you're considering a candidate, what kind of knowledge does a student need? Or, what can they talk about in an interview, or what kind of experiences have they had? So I guess that last part, I'm just wondering, in addition to classes, if we have students who maybe haven't had a job yet, or maybe they've had just, part-time jobs and an internship, is there experience that you're looking for, or are there recommendations you could make to the students on the call to say, okay, try to do this maybe before you graduate, or to, set yourself ahead as a candidate for a position?
Absolutely. If you can, get any kind of on the ground experience, whether it's volunteering or shadowing or internship, anything, that will help tremendously, because experience does play a large piece in it. But again, we're trying to develop a great relationship with UT Dallas to give people the opportunity straight out of school that they might not have otherwise. So in that case, I would say definitely focus on financial classes that give you, that teach you how to run a business, that teach you, how to create and manage and fully manipulate profit and loss statements or a budget. If there's a class where the project is developing a P&L statement for a business, that's phenomenal, because that's kind of the lifeblood of what our operations managers and regional managers do, is making sure that everything that we do is geared towards, of course, providing the patient experience, but making sure that it is financially viable. So I would say anything financial, and then in addition to that, I would stress the human resources and operations management piece of things. So I know that that's kind of vague, but if I can give specifics, I would say financials. That's probably the number one thing that we look for, is people that can be responsible for the finances of anywhere between a $1 and $5 million office.
That's super helpful. And I just put your email in the chat. So for students on the call, feel free to email. What should they send you? Resume, cover letter? What would
Any and all of the above. Definitely a resume. Let me know that you're from UT Dallas. I'm a double Comet alum. I love Comets. So, I got my scarf, as you can see. So
yes.
we don't have, so we have the operations manager trainee program already in place. So when you graduate from that program, typically our operations managers trainees convert directly over to operations, full-time salaried operations managers upon completion of that program. And compensation-wise, I know everybody's probably a little curious about that. So compensation-wise, our operations managers earn between anywhere from $45,000 to $60,000 salary, but there's also a bonus and incentive structure in place. And I've got one in McKinney right now that's making an extra $3,000 a month on top of $50,000 salary. So he's killing it. Obviously, that depends on the financial viability and performance of each office. But it only goes up from there. Our regional manager opportunities start at $80,000 salary, and have 40 to 50% bonus. So with 3 to 5 years of experience coming straight out of school, you could be making six figures in this type of role.
I mean, honestly, I just said it. Who knew the possibilities and the potential in this, especially in your company? And I think, as you talked about a few times, it speaks to the values that the company shows in I guess, how much emphasis they put on hiring good people and then supporting good people, that they want good candidates to stay.
So invested in growing and developing the talent that we already have. But of course, we look for amazing candidates outside of that as well, that we can grow and develop even more. So we are very big on internal advancement, internal promotion, and it's man, I drank the Kool-Aid, and it was great. I would drink even more if I had to, but I don't. I just it's I've been working here, over 3 months, and I wake up still excited to get to work each day. I get to do events all over the Metroplex, and I got to go up to Oklahoma City for a Top Golf event, with third and fourth year dental students. I did the same thing at Top Golf in Dallas last week. And I get to work from home. So it's great. I love it. And I can't speak highly enough of the company and the opportunities that they provide.
That's awesome. All right, students on the call, any last minute questions? Anything you want to stick in the chat?
And if you have any questions that come up afterwards, my email's there. You're more than welcome to reach out to me. Would love to get in contact with any of you that want more information, and happy to help.
Great. Well, Lance, this has been amazing. We'll be in touch with other opportunities too. So I'm so excited that we've connected and getting these in front of our students. This is really helpful. Thank you
so much for the opportunity to present, and thank you to everyone that came. I'm very excited to be here and look forward to speaking with any and all of you.
Great. More to come then. Thank you so much.
Appreciate it.
Thanks, Quincy.
All right. Take care. Bye-bye.